Infertility impacts 1 out of every 8 couples, so it's relatively common. So 15% of people trying to conceive will have an issue and meet the definition of infertility.
Hi, I'm Dr. Alok Patel.
And I'm Dr. Jamie Rutland.
And we're here to give you straight talk about a lot of the medical terms that you all are Googling. Today, we're talking about one that I have recently Googled myself, infertility. Do you ever worry about infertility?
You know, I do worry about infertility.
Is that the end of your story?
Don't have a story.
Cool, well, I worried about infertility. I now have this adorable toddler daughter, but 2 years ago I wondered. I looked at some stats and I found out how many times infertility is linked to issues with sperm versus issues with ovaries, uterus, fallopian tubes, and I was like, oh my gosh, are my swimmers strong enough? I have no idea, but here's a question for you. How much about infertility did you actually learn in medical school?
You know, I probably learned about 2 weeks worth of infertility, but what was interesting about what Dr. Patel just mentioned to all of us is he said he started thinking about infertility. I started thinking about infertility about a year ago because my wife had breast cancer and had to take tamoxifen, and we were thinking about having a 3rd child. So there's lots of different random things that you have to think about when it comes to infertility, and we felt that we would take this time today to discuss infertility with not only ourselves, but with a medical expert.
That is a very good point, because a lot of times people look up medical terms, they're almost reactive. There's like a reason for them to go look at it. We want to be proactive. In medical school, we learned all about different diseases, medications, and conditions that can affect reproductive organs and subsequently affect fertility, which is why we're talking about it now, because there's a lot more to it.
So I was gonna ask you this.
Yeah.
I do have a question for you.
Hit me.
So you have on a Henley, but you have on a cardigan over the Henley.
I do.
Is that something that you do commonly?
No.
I have a real problem with your cardigan.
Why? Why? What does that have to do with anything?
Nothing.
I look cute. I'm like a nerdy Indian Mr. Rogers. Hello, welcome friends. Talk about fish. I have a fish tank. Indian Mr. Rogers. So we are joined today by board-certified fertility doctor, obstetrician gynecologist, all-star reproductive endocrinologist,
And our friend,
Dr. Natalie Crawford. Dr. Crawford, thanks for joining us.
Hello, Alok and Jamie. Thank you so much for having me. I am honored to be here, and as you know, I am so passionate about fertility and thrilled to talk about it with more people so that we can all be a little bit more educated about our reproductive systems.
Number 1, Dr. Crawford, how do you define infertility?
Infertility actually has a different definition based on how old you are. So the definition of infertility, if you're under age 35, is trying to get pregnant for up to 12 cycles where you're having regular unprotected intercourse. If you're older than age 35, then it is 6 months of trying to conceive without a conception.
So based on that definition, I understand now why it's more common than a lot of us thought.
Natalie, how common is it? And does it affect both the male reproductive organs and female reproductive organs equally?
Infertility impacts 1 out of every 8 couples, so it's relatively common. So 15% of people trying to conceive will have an issue and meet the definition of infertility. Infertility can impact both the male and female reproductive systems, or just people who have sperm or eggs or uterus. When we think about all the things that we need for somebody to get pregnant, we need a uterus that is normal, fallopian tubes that are open, ovaries that ovulate, and a sperm source. And all of these things can go wrong.
So you hear that? If you have sperm, this also potentially affects you also. Natalie, how often is abnormal ovulation the cause of infertility?
Ovulation is the cause of infertility about 20% of the time, or it can be where you have irregular ovulation and irregular periods. A variety of things can cause anovulation. It can be PCOS, which is polycystic ovarian syndrome. It can be thyroid or pituitary hormone abnormalities. It can be something called functional hypothalamic amenorrhea. It can also come from chronic stress, eating disorders, or a variety of other causes. So if you are not having regular predictable periods, which I define as able to pinpoint on a calendar within just a couple days of accuracy every single month, then you need to seek care.
So that tells me that there's a lot of other causes of infertility. Thanks for that answer, Natalie.
Number 4, how often is the cause related to sperm, whether it's the way the sperm looks, swims, or the count?
So in about 20% of cases, the only cause of infertility is sperm or male factor. And as we said before, up to 40% of them, there is some contributing male factor. Now, the way that we test for male factor is with a semen analysis. It is actually giving us a lot of information about both how male hormones are functioning and anatomy, because you need all the parts to work together to get sperm into the ejaculated sample.
And one of the questions that I have in follow-up is it ever a problem with the reproductive tract in a male?
Within the male reproductive tract, you can have a few different abnormalities. One is called congenital bilateral absence of the vas deferens. Many people don't realize that the sperm is made in the testicle and it has to travel through a different duct system to get into the ejaculated sample. You can have blocked or absent vas deferens, and this means that your body makes sperm just fine, but it's not going to be into the ejaculated sample.
So it's actually fascinating. I've always wondered how people assess the health of swimmers.
Number 5. So what does treatment actually look like for infertility? Is it medications? Is it surgery? I feel, and what I'm reading is that most of the infertility that's out there can be cured, if that's a word in this subspecialty, by using medications or surgery. Is that true?
Infertility really is never actually cured. That's a misnomer because sometimes there's multiple things going on. We actually have limited ability to treat infertility depending on what is happening. Sometimes you can do surgery. If there's a fibroid or a polyp inside the uterus, that might make a difference. But most of the time, surgical resection is not going to get you pregnant. You can have medications to help somebody ovulate. So if you're not ovulating, we can try to induce ovulation by either giving you medications to increase the secretion of FSH from the pituitary gland or giving you FSH shots directly. We also can do an IUI, which is an intrauterine insemination. This is where we take the sperm and we process it and we put it inside the uterus. I always use the analogy of taking your best players and putting them further down the field. I can't make them make the shot. So if they all suck or their legs are all broken, they're still broken. So it doesn't overcome morphologic issues, but definitely can help with a motility or a concentration issue. And then we have IVF. IVF is the only treatment option that's ever going to get you over your age-related chance of getting pregnant. Your best chance of ever getting pregnant is when you're under the age of 30, and you would have a 20 to 25% chance of getting pregnant per month. As you age, that number drops profusely. If you're age 35, you have a 10 to 12% chance of getting pregnant per month. If you are 38, it is 5%. If you are 40, it is 3%.
So, not surprisingly, it's individualized based on the cause of infertility. Not like a one-size-fits-all solution, but you've got to chat with someone like Natalie. Number 6, Dr. Crawford, this is a question a lot of people have, but what are some risk factors for infertility? And what are some things people can do to protect their fertility?
So if you have history of having prior inguinal hernias or your testes were undescended as a child, that often exposed them to too much heat or could surgically interrupt the blood supply to the testes. So those are 2 history factors I look at that might give me a clue that something could be off. What can happen is if you have a varicose vein, a varicocele on your testes, even though they're outside your body, that's bringing blood. Blood is warm, and that increases the heat of the testes and can damage the production of sperm and hormones. This is also why we do not recommend having your laptop in your lap, sitting in a hot tub or sauna, or anything that's causing excess heat to get to that area. One quick myth is that it doesn't really matter what briefs you wear, briefs, boxers, whatever your underwear of choice is, that's not enough heat generated to be a problem. It is really external sources of heat that is an issue.
Last but not least, Dr. Crawford, how does diagnosis really work when it comes to infertility? There's so many different reproductive organs that are potentially affected. How do you decide what to do, when to do it, on whom?
So really when it comes to infertility, there's not that many reproductive organs that are involved. So we do, there's your brain, your ovaries, your fallopian tubes, your uterus, and if you're a person with sperm, there's your brain, your testes, and your ejaculatory system. So we can evaluate all of these, and a normal fertility evaluation process would be a consult with a fertility doctor, a semen analysis, history or test to see if you're ovulating, test to see how many eggs you have remaining, evaluation to see if your fallopian tubes are open, and an evaluation to see if your uterus is open and normal or has any obstruction. If all of these things are normal and you are not pregnant and you meet the criteria for infertility, you now have unexplained infertility. My best advice to people is that if you have any warning signs, do not just keep trying. If those periods are irregular, if you're having difficulty or pain, then you can always seek an evaluation early. And even if everything's fine and you're just concerned, or if you're waiting to start your family and you want more than one child, doing an evaluation and getting data is never going to be the wrong thing. You can't make decisions on data you don't know, so getting that information is going to be very helpful.
Thanks, Dr. Crawford. We really appreciate you answering our questions today for our viewers and for us. We really appreciate the help.
And because we covered infertility, something that you are a specialist at talking about, we should probably do another video in the future about IVF. What do you think?
IVF is such a complicated topic. I would love to do a video with you guys in the future and break it down because it is something that I see about so much misconception. People are scared of it. There's so much out there. It seems so overwhelming, and I get it because there's hormones and a procedure and it's expensive and it's not usually covered by insurance. So I think breaking down the basics of IVF would be a fantastic idea, and I would love to be back.
If anyone else agrees, which you all probably should, comment below.
Hit that subscribe button, hit that bell button so you can be alarmed when we release a new episode.
Tell us what you're Googling, and we will Google them and make another video and dedicate it to you.